I think the concept of HARPA is extraordinary, and it is HARPA's moment to come forward. You know, when Sputnik was launched into orbit, it set in motion an existential crisis for the United States. Suddenly, they were recognizing a profound inferiority in technology as the Cold War unfolded with the Soviet Union. And it was really in that context that DARPA was born. It was born to strategically address this technological inferiority that we are facing. We were facing with the Soviet Union. And it was Eisenhower's pen that really set in motion what we now know as DARPA. DARPA as a model has been very effective in addressing over many years that original existential threat of the Soviet Union, which has faded, but the innovations like GPS and stealth technology, the internet, microelectronics, many of these innovations, well beyond their strategic utility to our military, have given rise to major innovations in the commercial sector. And as the Cold War has faded, you know, we're facing a new existential threat. And that threat is really arriving on the shores of our country in the form of Zika virus, pancreatic cancer, and many, many devastating human illnesses. It's time that we take that same model that was born in DARPA and reapply it to the healthcare world. Because it really is there's so many commonalities between what the country was facing in the late 1950s, you know, with the birth of DARPA, that we're facing on the healthcare front today. It makes HARPA, it makes the idea of trying to address our technological inferiority against human disease at a moment in time it's so necessary. Central to this, I think, moving forward will be how we leverage the innovation that exists in the private sector alongside the innovations that are already available even in DARPA to be applied. You know, there are many, many technologies that have been developed by our own government to target and deliver weaponry to remote parts of the world on demand. You know, when you pop open the hood, some of these same technologies can be used to target and deliver innovative treatments to locations inside the body. Just like we need to know where bad guys are in some remote cave, you know, somewhere across the globe, we need to understand what's brewing inside the pancreas of individuals who will soon have that diagnosis before it's gotten too significant. And HARPA is just the kind of model that's fit for today's world. DARPA has oftentimes been referred to as the special forces of strategic research in the military. Special forces oftentimes work leaner, more agile, they're focused. NIH and HHS have been very effective, large investments in basic medical and health research over many years. But they're big. They're slow to move. They're impactful, yet they are not agile. And the types of technologies that are needed in this war on health, if you will, this value argument behind HARPA, are better suited for a DARPA-like model that is much smaller, much leaner, with limited duration types of projects that bring together stakeholders from all sectors of the research ecosystem. DARPA was not focused on a single theater of combat. It was really a response to the larger threat born in this inferiority of technology we faced with the Soviet Union. It was playing out in space. It was playing out on the oceans of the world, and it gave rise to many technologies that were not specific to one theater of combat, if you will. HARPA is is really an opportunity for us to treat health and disease as a single common enemy.